Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning. It is Monday, September 14th.
It is Monday, September 14th.
Week 27, it must be, right?
27.
Look at that.
27 weeks.
How about that, everybody? Welcome. Good to be with us.
Yes.
Finally. There we are.
Fine. Oh.
Well, we're a little late today.
Finally on this. Yeah.
And we're on the screen. The cameras are on now. So.
Yeah, tech segment went a little long, huh?
It did. Yeah. We kept talking about drones. But anyway, here we are.
Hey.
Good to have everyone with us. We are back to talk a little bit about what's going on in the community. Our local information program about COVID-19 will be joined by Jeff Bourgeois from San Juan Regional Medical Center, calling in a few moments to give us an update on what's going on at the hospital and just some other updates. I know you've been doing a lot of reading about what's been going on.
Yes.
So we'll get maybe an update on that, on your reading skills.
An update on my reading skills.
Yeah,
okay.
Your comprehension.
Oh, very.
Can you?
Yes.
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 But we're looking forward to that.
And retention.
Yes.
I have both.
Nice. We rely on that a lot.
We
so
do.
Let's get started. The testing schedule this week, again, this evening here at San Juan College for actually much of the week. Take a look. Monday, September 14th, 6 p.m. to 7 p.m. here at San Juan College. Tomorrow, September 15th, 6 p.m. to 7 p.m. here at San Juan College. Thursday, September 17th, 6 p.m. to 7 p.m. Say it with me. Here at San Juan College. And then the mornings of Friday, September 18th, here at San Juan College.
Yeah, good. Good for us.
Yeah. Well, I think it's a nice way. I think they can manage the numbers here at the college. They have the parking lot available, and if you've been here, you can kind of see how they can direct traffic, and it's a little bit easier, I think, to manage the numbers rather than maybe at the Department of Health office there on Miller Street. So, again, the reminder to register before you come at cvtestreg.nmhealth.org. Or you can call them, again, 327-4461, and they will get you registered if you need a test. But again, our state is still offering these tests free of charge.
Yeah.
To let folks know what's going on.
I'm never going to look at like a pop-up canopy tent the same way again after COVID.
Well, you're either getting a COVID test or you're eating lunch outside.
That's
right. It's one of the two.
That's right.
Under one of those tents. But that's how it goes.
COVID tents are usually white, though, so I feel like...
Sure.
I'm going to always buy a different color now.
Really?
Not that I'm like buying
how many do you buy?
Exactly. It's my yearly canopy
Your
tent
little tent
purchase.
Village at the Cullip House. Okay.
Tent village.
Can't wait.
Oh, gosh. We're pulling a Seattle in my backyard.
Right.
Whew.
Very good. Well, there you are. So that's
right.
what's going on this week, everybody. And let's check other numbers.
Yes.
We got the Johns Hopkins numbers to share as well. All right.
This time we're going to match each other.
Okay, let's see.
Cool. Okay, so U.S. confirmed cases, 6,525,887. U.S. confirmed deaths, 194,107, which I would like to say that they were projecting 200,000 by Labor Day. Okay. And we're not there, and this is a good sign.
Apparently, we have after Labor Day, and we're not there, which is good. So.
Yeah, we have a 20% decrease in daily cases on average.
Nice. And we can kind of see that on the video at the lower right of the screen there of those daily case numbers that Johns Hopkins kind of keeps track of. But you can kind of see that lower from the peak in July. It's kind of come down, which is good.
Yes.
And so that's good news. Although we are still hearing about some upticks in some parts of the country.
Correct.
Not everywhere, but some parts are still getting hit hard. The Dakotas, I heard, and read, were getting some high cases coming in. And so
the best way I heard it described was an epidemiologist from Emory University was speaking the other day and said that they're kind of looking at it as multiple epidemics around the country.
Okay. Interesting.
So, so as the epidemic, settles down in the Northeast, we have one in the Dakotas, et cetera, et cetera. So,
I see what you're saying.
Yes.
Got you. And that makes sense. That's true. And I think a lot of folks are saying we're still in kind of the first wave of COVID, that we really haven't gone into the second wave. So
we'll have to ask the docs.
We will. Maybe we can ask them this week.
Yeah.
We'll see. But we do have our first
great.
guest on
Wonderful.
the line here who's called in. And good morning. You're on KSJE. Thank you for calling in this morning.
Hi, Scott. This is Jeff Bourgeois. How are you today?
I am good, Mr. Bourgeois. Great to have you here. Jeff Bourgeois, of course, President and CEO of San Juan Regional Medical Center. Thank you for calling in. And as usual, our first question to you is, what's the latest at the hospital? Can you give us kind of a status update on this Monday?
Sure, you bet. We have 124 inpatients today. Only 4 of those are confirmed COVID-positive patients, and we have little over a dozen more pending test results. So, the overall COVID volume at the hospital remains way down from our peak. We are seeing a 14-day rolling positivity rate of less than 2% now. So, continued softening of the rate of spread in our community as well, which is good news.
That is very good news, Jeff Bourgeois, and that kind of confirms what we see daily from the state, right? Their New Mexico Health Department numbers, which we'll be checking in just a moment here, but it seems like in San Juan County, those numbers have been maybe in the single digits for the most part. There have been a couple days maybe in the lower double digits, but it seems like those numbers really have come down a lot from where we were when we were talking to you maybe back in, April, May, and June.
Yeah, that's exactly right. I'm looking at a report that says we've only had an increase in 6 positive cases in total in San Juan County since last Friday. And as of this morning, the Department of Health is only reporting a total of 59 patients hospitalized across the state, confirmed COVID positive patients. That's a decrease of 21 from Friday when it was up at 80. So continued reduction in the number of hospitalized patients statewide as well.
Hey, good morning, Jeff. I do have a follow-up question on the 4 COVID-confirmed cases. How many of those are in intensive care?
Megan, I don't know. I do know that one of them is, we have one of those patients that are pending a test result that is intubated. But I don't have my fingers on the information to answer your specific question.
Got you. But the numbers are low, which is good news, Jeff Bourgeois, as you mentioned to us, and we appreciate that. And I know you and a lot of the folks we've spoken to at the hospital are a bit concerned about flu season. I know the word is getting out for folks to make plans to get their flu shots because, again, we don't want to overwhelm the hospital with COVID patients and flu patients.
Right. So... And last time we spoke, I told you I'd have an update for you on our flu shot planning. So historically, we've offered walk-in clinics for flu shots, and so we're making the majority of plans this year to be drive-through clinics to be convenient for individuals as well as to ensure safety and the use of COVID-safe practices. So we're working now with the Department of Health and San Juan College to offer some drive-through clinics in October. Don't have the specific times and dates yet to publish, but we'll certainly have that available on our intranet as well as the Department of Health's website as soon as it becomes available. Of course, a number of our primary care clinics that are part of San Juan Health Partners as well as other primary care clinics in town will certainly have flu shots available for their specific patients. So there'll be a lot of work throughout the community to offer flu shots. Most local pharmacies also have plans to provide them. So we want to encourage everyone this year to get a flu shot unless it's really clinically contraindicated. But for most of us, it's not, and we encourage that bit of protection, and then also to continue COVID-safe practices wherever you go until we get this virus behind us.
Yeah, very good. I always say that it's not fall until I get my flu shot. That's like my inauguration into autumn. But
not pumpkins, not pumpkin spice lattes. It's a flu shot for me.
It's always a flu shot for me.
Okay, all right.
So speaking of, and you might have already said this and we maybe missed it, but is that a no-cost thing for our community?
I believe so, Megan, but we just need to validate the work we're doing with Department of Health and San Juan College on that. That's why I say some of those details are still pending.
Very good. Well, Jeff Bourgeois, we certainly, as always, appreciate you calling in to be with us and to give us an update. Go ahead.
Scott, I'm sorry. I do have one other important thing I want to update your listeners on, and if you could help us communicate it. But we're experiencing some significant IT issues here at the hospital. Our external email communication, and our internet connectivity. So when we try to reach out from computers within the hospital internet, we do not have access to that right now. The IT issues are not impacting our ability to use our clinical systems and is not affecting care. Our IT team is working around the clock. We have support teams we brought in to help us work through these challenges. However, we don't know yet how long it will take to get our internet connectivity and our external inbound and incoming and outgoing email up. So if you send an email to anybody in our organization within the last few days, that communication may not have been delivered. So we encourage anyone needing to contact us to please call the specific individual department you're trying to reach. You can find many numbers listed on our website, so our website is still visible to external users. So that's SanJuanRegional.com. We also have operators available 24/7. That number is 609-2000. And we'll continue to use our website and social media platforms such as Facebook and Twitter to update the public. And we just want to make everyone aware of that and also thank them for their patience as we work through these issues.
I'm glad you mentioned that, Jeff Bourgeois, and I appreciate that, and I can know how frustrating that can be when the email is down. And this involves all of the hospital's email accounts, correct? So even not necessarily at the main hospital, but at some of your satellite clinics and things like that, that would also affect communication at those areas too. I would assume anything with an SJRMC.net email address would be affected, right?
That's correct. Now we can communicate internally amongst our teams here at the hospital. So our internal email is still functioning. If I were to try to send you an email, Scott, or you send me one at my work email address, we wouldn't connect right now.
Understood. Well, we're glad we've connected by phone, Jeff Bourgeois, and again, that's a great way. Again, if folks are trying to reach someone there at the hospital and they have not heard back, chances are maybe their email did not go through, and to just pick up the phone and kind of do it old school today.
Yeah, that's right.
Right.
Perhaps send a letter.
A letter. There you go. Telegram, maybe.
Yes.
I don't know. But we hope it's short-lived, and again, we'll share that news when it is, Jeff Bourgeois. But thank you for calling in and giving us an update today.
Very good, Scott and Megan. Y'all have a wonderful Monday.
You too.
All right. You as well. You're welcome. That's Jeff Bourgeois, of course, President and CEO from Sept Regional Medical Center. We appreciate him calling in, and nothing more frustrating than having email down, especially these days.
I know. Oh, I have like 4 different accounts at this point, and so we were getting bounce backs, and I'm like, is it the college? Is that
right?
Like,
you usually think it's you.
Yeah. Yeah.
Right.
Yeah. Usually, Megan messed up the IT.
Right. Another computer virus or something.
That's right.
That's
too much COVID research, bogging down the system.
Something. But anyway, we hope that they can get that fixed quickly. But that's a lot of email accounts at the hospital.
That's a lot of email accounts.
They've got a big. It's a big employer.
Who knows? Yeah.
But anyway, so back to more numbers we want to share with everybody. Again, from KSJE.com, from the New Mexico Health Department is what I was trying to say. This is from our website, and you can kind of see. And I thought this was notable. Again, this is just the daily numbers that we share every time. New Mexico had about 103 new cases yesterday for a total of 26,761. But San Juan County had 0 new cases yesterday, and I don't recall seeing that.
Ever.
Yeah.
Me
since
neither.
March.
Yeah.
0, and I had to double check. I was looking at the list. I was like, did I miss it? But we had 0 new cases, so we're still at 3,233. 2 deaths in New Mexico yesterday, which again is a lower number than we have seen, and 0 of those were in San Juan County, and 11 new recoveries, and we're now at 14,396. So there is that news, which I thought was good, and those numbers continue to be low for San Juan County, which again is excellent. On the Navajo Nation, again, they had 8 new cases on Sunday, 6 additional deaths over the weekend on the Navajo Nation, and so they're now at 9,977 for the reservation. But their numbers have been lower as well.
Yes.
Which is good to see.
Yes.
So we certainly celebrate that with them and keep them in hopefully going in the right direction, same direction.
Right.
So that would be good. So there you go. You have found some other information?
I have.
Other research, right?
I have.
Okay.
I have. So
what'd you find out?
What did I find out? So the aforementioned epidemiologist from Emory University, this is also part of his talk. He was referencing genetic mapping. So to genetically map a virus is a very, very new piece of technology.
Sure.
Best way to describe it. And this was what was mind-blowing. It's basically, once they were able to nail down the virus and map it, 62 days after that, they already were testing a vaccine. 62 days.
Right. That's amazing.
It is amazing.
You know, because when I think we've talked about this before too, with prior vaccines for these ailments that have afflicted human race, like polio and things like that, right? The vaccine took years of development, not months, weeks.
62 days.
Yeah, that's what we're talking about. So amazing. And they do that now with every virus, don't they? Try to map it?
Yeah. Yes. Well, genetic mapping is, it's like the new standard. And but he was also discussing how currently they feel like the vaccine is going to be maybe 50% effective, right? You give a vaccine to 100 people, 50 of them would be successful, maybe roughly. And so just to further press, even when a vaccine comes on the scene, we'll still probably have to practice the same rules of mask and social distancing, which leads us to our next piece of research, which you actually sent me. So if you want to discuss it, now's your chance.
Okay. I'd have to remember what I sent you.
Okay.
But I do.
All right.
But it was
you
late.
Want me to go? Okay.
Well, I know you read it, and so did I.
Yeah. Okay. So
go ahead. You're prepared. I did not review it before the show this morning. I read it last night.
Yes, at like 10:30, I think, is when you sent it to me. Late night research. So this was the Telegraph reported on this. The Telegraph reported on a report from the New England Journal of Medicine.
Yes.
And so they
pretty reputable publication.
Very, yeah.
Okay.
One of the primary. And so what they were saying was that there's been a lot of talk about viral load, right? Meaning that if you were to contract the virus, the amount of your initial exposure can affect the severity of it. Makes sense, right?
Okay.
Right? Sneezed on versus maybe breathed on from 6 feet apart or something, or maybe it's still in the aerosol and you quickly get in and out of whatever space that is going to affect your viral load. But what's really important is we've been saying that, and this is still true, right? You wearing a mask is really protecting me from the virus and vice versa. But also they're discovering that also just wearing a mask can reduce the viral load. So it also protects you just wearing the mask. Does that make sense?
I think it does.
Yes.
So the virus maybe with a mask on can't maybe get into your nose or mouth
to a lesser extent,
as big a volume as it could if you weren't wearing a mask. And if it's not a bigger volume, the severity of your COVID may be less than it would be with a larger viral load that you inhaled or somehow ingested or whatever. That's what we're saying.
That's what we're saying.
See, it's all coming back now.
Yeah,
I did read it, and I did.
Right, and they were quick to note,
which is interesting.
And they were quick to note that this is a working theory and process, and
because we still don't know a lot of these things about COVID. We kind of think we know how it spreads. We've that information has been coming out all spring. At first it was don't wear masks, and now it's do wear masks, and we think it's more spread through the air, and it can linger in the air, and all all these things.
How long
that
does it stay on a surface? How long does it stay in the air? Does it stay in the air? Yeah, that's all stuff that they've been working through.
Right. And why do some people's cases are more serious if they have underlying conditions, but if they don't, why are not every COVID case maybe as serious as others? And that's another thing that we are studying to try to learn more about this.
Correct. And there was also a study that I read, it was tripled up last night.
Look at you.
I know.
Wow. It's amazing you're awake this morning to be here.
What can I say?
Thank you.
You're welcome. Now that you're evoking a yawn.
Right.
Sorry. It's amazing. Jeez. So young people. So colleges have been opening, and there has been an increase in young people cases, but really they're tying that back less to classroom practices, because in a classroom it's very controlled.
Right. Well, they've all adopted these COVID safe practices, so desks are separated. Usually there's maybe a divider.
There can be.
Those things. Right.
The requirement, you either wear a mask or get out, and like that kind of thing. And so it's spreading mostly, and this is no surprise, because I've always had a judgment against the Greek system.
Uh-oh.
And I don't mean like the Greeks.
I know where you're going.
I don't mean like Greco system. I mean
Right.
fraternities and sororities. So
what's going on?
well, they're the hot spots. You know, they get around each other. They're too close to each other. They're
Are
not
they having
wearing
parties?
They're
Is that
having
what you're
parties.
saying,
I mean, yeah, that's
basically?
all they do. That's why I was never a fan.
I think some may be more academic based. I wouldn't put all fraternities and sororities in the same pot.
Were you in a fraternity?
I was.
Aha!
And they were more academic than parties. But anyway, I understand what you're saying. But the majority of these cases on college campuses are coming from parties.
So, I mean,
Whether they're Greek-based or not, I think any college student can have a party.
well, sure.
All right.
But we all know
Somebody wasn't accepted into her sorority, is what we're finding out this morning.
I never even tried. There was like an entry fee. That's
I
like,
see. I'm
nothing
out.
is worth the cost of admission in my
I'm out.
world.
I'm
yeah.
out. Okay.
Yeah. So anyway,
But-
so just
But that's what's happening.
Be
It's
careful,
not
students.
spreading in classrooms. It's spreading socially, in
right.
parties.
Yeah, parties. So.
And a lot of those students are getting expelled, I think, if they're
yeah.
caught.
Yeah, expelled, or
Explain
maybe
that
they
to mom and dad.
right, or maybe they lose their financial aid or something.
Yeah,
I mean,
right.
So which is good, I think. I mean, many people, right, until you get the consequence, you're not necessarily going to be as conscientious. So
Very true. So
yes,
there you go.
So anyway,
Well,
there you go. Watch your
interesting.
partying, people.
Yes. Well, again, that goes against all the COVID safe practices we've been hearing about.
Right.
You know, and so there's reasons and facts behind why we're being
Yes.
told to do what
Yes.
we're being asked to do.
Yes, fact based.
Right.
Correct.
Which is important. So there you go.
Cool.
Very good.
So that's I think
our
it
update
for
today,
today.
everybody.
Yeah.
I know. And we'll be back on Thursday, of course. Again, the testing is happening here at San Juan College, mostly in the evenings this week. And we appreciate you watching, of course, every Monday and Thursday. This program is always rebroadcast at noon on KNMI Radio, 88.9 FM, and also at 5:06 p.m. on Mondays and Thursdays, KSJE, 90.9 FM and 103.3 FM. So until Thursday, everyone,
We'll see you then.
stay safe, and we will see you on Thursday. Bye-bye, everyone.